Hi everyone. So let's go ahead and start with section 2 of chapter 19, and we're going to be taking a look at how the heart is within the thoracic cavity. So we're going to take a look at location and position of the heart, and then we're going to be taking a look at different components that kind of secure the heart and protect the heart within that thoracic cavity. So let's introduce the position and location of the heart. So as far as the size of the heart, it's about the size of a fist. And the shape is more kind of like a pine cone shape. If you understand how a pine cone is shaped, it's a little bit bigger on top, and then as you kind of move down, it's going to be smaller, and that's exactly how the heart is going to be. As you can see, it's bigger at the top, the superior portion, and then it's going to be a little bit smaller at the bottom. So the bottom part, or I guess I should say the inferior portion of the heart, is known as the apex. And then the superior portion, where all of the great vessels it's going to be known as the base of the heart. So other things about the position, it's posterior to the sternum. It lies a little bit more on the left side of the body, so a little bit left of the midline. And it's going to be enclosed in that mediastinum. Remember, the mediastinum is that cavity that is going to, middle cavity that's going to be right in there. So it talks about how the way that it sits inside of the body, the right side is more anterior than the left. So if you take a look at it here, here's the right, and it says that the right side is a little bit more anterior. I don't think that picture does much justice to that. So again, we talked about the base and we talked about the apex and how it kind of has that conical end to it. So if we take a look at what's surrounding the heart and these protective layers that it has, that is going to be the pericardium. And the pericardium is going to have 3 layers to it. There's going to be a fibrous pericardium. There's going to be a parietal layer of the serous pericardium, and then a visceral layer. So you have this fibrous layer, and then you're going to have a double serous membrane. So don't get these two confused here. They're made of a little bit different fibers or tissues, I guess I should say. And then this is something that you should have been introduced in 2401, the different serous membranes of the body, and here is the serous pericardium. So you always have a parietal and a visceral layer. The visceral layer is always going to be the one closest to the organ, and then we'll talk about the parietal layer is usually the one that is kind of lining the body wall or the body cavity. All right. So if we take a look a little bit more, we'll actually be diving into these here in a second. But if you look at it right here, this little picture, do you see how it kind of, here's that visceral pericardium. And then if you turn, it turns, and it's actually double layered, and it's a continuous layer, and it turns into the parietal pericardium. That's what that is. It's a lot easier to say parietal pericardium, visceral pericardium. You can refer to them that way. You see how there's like this cavity right here? This is the pericardial cavity. And what we have inside of the pericardial cavity is going to be serous fluid. So that serous membrane actually makes this fluid, and it is going to put it inside of that cavity right there. And what it makes sure that it's doing, it's going in and lubricating. So whenever the heart pumps, I mean, if you think about it, the heart is changing shape because it's going to contract. It's going to kind of get a little bit smaller when it squeezes, and then it's going to relax. So we don't need those layers to rub together. So you have this serous fluid that's going to prevent them from rubbing together. We'll talk about a condition whenever it actually does rub together. So it creates this kind of frictionless heart movement. So let's go ahead and dive deeper into the different layers of the pericardium. First, taking a look at the outermost covering of the pericardium, and that's the fibrous pericardium. So this is actually made of dense, irregular connective tissue right here. So it is it's much thicker connective tissue that we're going to look at when we get to the actual serous membranes. It attaches to the diaphragm. Look, take a look at it right here. And also the base of the aorta as well. So it's kind of going in and zooming in a little bit more, and the pulmonary trunk. And what it does is it's going in and anchoring that heart inside of that thoracic cavity. And it's also going to prevent that heart from overfilling as well. All right, now let's dive into that serous membrane. And we are going to first take a look at the parietal layer of the serous membrane. So again, you can just say, I typically just refer to it as parietal pericardium. But that, as you can see, look at it. It is going to actually attach to, and if you look at it right here, it's attached to the fibrous pericardium. So these are made of, serous membranes are made of like a simple squamous epithelium with a little bit of areolar connective tissue underneath. So it's a lot thinner, more delicate membrane that you're going to have here if you compare it to that fibrous pericardium. That's that thick, dense, irregular connective tissue. So let's go in and take a look and see how it is going to form, and look at this a little bit more, this visceral pericardium here. So the visceral pericardium, this is going to be made of the same, it's still a serous membrane, so it's still that simple squamous epithelium with a little bit of areolar connective tissue. It is going to lie directly on top of the heart, so it tightly adheres to the heart. And it's also known as the epicardium. So when we get into the wall layers of the heart, we will come back to this visceral pericardium or epicardium. So these are going to attach to the arterial trunks. So that is basically it for the pericardium. And again, it's a very nice little protective mechanism that we have, especially once we add the serous fluid into it. So let's take a look at the importance of that serous fluid and make sure that this does not occur. So pericarditis, and if you know your root words, you know what itis is. That is inflammation. So anytime you see that, it's inflammation of the pericardium. And this is typically, it can be from viruses, bacteria, or fungi. So any of those can cause pericarditis. But what happens is the epithelium, or the capillaries actually inside of the pericardium, they become leaky. So that's what that means, increased capillary permeability. They become leaky. Fluid, more fluid than necessary, is going to seep out. So more serous fluid is going to seep out and collect into that pericardial cavity, which is not good because you want a little bit in there, but you don't want a whole bunch. If you think about it, it's like overfilling a balloon that you're trying to, put a fist in. And if you have something that's overfilled, that's not going to allow the heart to move like it needs to. Remember that the heart needs to be able to contract and then relax and contract and relax. But all of this serous fluid that collects inside of the pericardial cavity because of pericarditis, it restricts the heart's movement, and it actually keeps the chambers from filling like it needs to. So there goes the blood volume in your heart as well. So this can result in something called a cardiac tamponade. That is what these terms are. So a cardiac tamponade is basically going to be this medical condition where the heart's movement is restricted and it's unable to pump. One thing that doctors can do to diagnose, that's what I'm looking for, diagnose pericarditis, is going in and listening through the stethoscope. And what they are listening for is kind of a crackling sound, or they're kind of listening for this actual rub. I don't know if you're able to hear my hands rubbing together, but that's what they're listening for, is they can go in and hear these sounds. If you just Google heart sounds friction rub, then you'll be able to hear exactly what it sounds like. Instead of that nice lub-dub, 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 it's more of a kind of rubbing sound instead. So that is basically it. Nice, short, sweet section, right? What we're going to take a look at in section 3 is now we're going to dive into the heart. We're going to go into little bits of the ins and outs of the heart anatomy. Like I said, a lot of the stuff in the book will be covered in APR. So if there is any questions about it, always use your book if you're having trouble finding some of those, some of the little tiny structures in APR. But that's the next section, is going to be heart anatomy. So until then.